We're back at 6:15 on a Monday morning and talk about getting under my skin. The subject is one
Getting into.
no, but this one gets under your skin, yeah? And
Okay,
we want to
very
say
well.
good morning to Dr. Andrew Forde, who's a resident dermatologist. And we're going to talk about scabies this morning.
Yeah.
And scabies is caused by a little
Mite.
troublesome little mite that gets into you.
It is.
Gets under your skin.
It is. Good morning to both of you and to
Good
the
morning.
viewers. Scabies is a very itchy skin condition, inflammatory itchy skin condition, and unlike the others we've discussed so far, this one is caused by a mite that gets under the skin. The mite is called Scariocoptes scabiei,
Easy
and
for
it's
you.
a variety of it's a hominous variety, and this little mite gets transferred from one individual to the other. So the first slide shows you a picture of the mite, an internet picture, and also that the mite is getting under the skin, as Doug would say.
Wow.
And that's where the mite actually lives.
So when that happens, what is the manifestation on the surface of the skin?
Well, the first manifestation, it can take about 2 to 6 weeks for you to start itching. And that's because the body makes this immune reaction to the mite, and you get itching, and that then manifests itself as areas that are excoriated or scratched. You also can get an eczematous type of change, but eventually you get these urticated bumps and papules.
Does it look like this?
Yes, so this is a picture of the torso of a lady who was infested with scabies, but it's just to show you that you can get a rash that's almost over the entire body. And so it can manifest itself even though there are only like 10 mites in the body, or maybe up to 100 or more if you're if your hygiene isn't up to par. It can cause a rash over the entire body.
So is
No,
that what it is? Hygiene? Poor hygiene?
No, it isn't to do with hygiene. What happens is that it's passed by intimate contact between adults and also contact between children. Hand holding is very important, but of course among adults, when you have intimate contact, there's extended contact between the skin, and the mites can be transferred. The mites can't fly or jump or do anything like that, so you need to be on you for a long time. Very rarely is it transferred through inanimate objects, and that only happens when they're high amounts of the mite around.
Okay.
So it gets under the skin. The female mites lay eggs and lay about 3 eggs per day. And the reaction to this laying of eggs and the saliva and the feces of the mite causes this reaction that we manifest in the skin. So children can be affected as well. You know, children, you just see them scratching all the time, and they're miserable. The parents are miserable. And this, again, shows you the generalized rash that you can get that looks a lot like eczema and fools a lot of doctors and people. So the problem with this condition is that if it's misdiagnosed, it relentlessly continues, because without eradication of the mite, you cannot get satisfaction. Just showing you the legs of the child again, and that it can affect the entire body.
Okay.
So do the mites move while under the skin? Or
Yeah, the mites burrow at about 1 millimeter or 2 per day, and they keep moving. And actually, one of the signs of the mite is the burrow. That's a diagnostic sign. But the areas that are affected are between the webs of the fingers, the wrists on the flexural side, and you see in children who are unable to walk, they get a pustular eruption on the feet that also looks like eczema. So it's the cause of something called palmoplantar pustulosis. But some of the other areas include the nipples, the navel, the genitals in men is another area that itches a lot, and also the buttocks itches a lot. So you can get lots of nodules, and this arrow shows you one of the burrows, which is about a 1 centimeter line that can either look white or it can have a black little line in the center. And at the newest point of that line is where the mite actually is in the body. So it requires the doctor to look very carefully at these areas that I mentioned, and especially in men, if a man has these large papules on the testicles and penis, then that's pathognomonic of the infestation.
Let me ask you though, are these the same type of mites that a dog would get, for example?
No, it doesn't affect dogs. It just affects people, fortunately.
Okay.
And it's the mite, you know, 4-legged mite. And the good thing is that it's treated by just things that you apply.
Okay.
So you don't have to actually fumigate the house.
Can this be seen with the naked eye?
They're very difficult to be seen because they're around 0.3 to 0.4 of a millimeter. So they can be seen under magnification, but usually they're not easily seen by the naked eye.
Okay. That certainly causes such a tiny thing causing such a an appearance.
Yeah.
Yeah.
This intractable itching at night or when you take off your clothes is the sign. So for the doctor, getting the story or the history is of extreme importance. If you don't get that story, then and you don't examine the person properly and take off their clothes, look for those burrows. Unless you have a high suspicion, you may treat it for something else, and that is a problem. The treatment, as I said, involves putting on some medication, usually from the neck downwards on the entire body, every fold and crease of the body. You need to apply it, and in some cases it has to be left on for the whole day, so you can't bathe for a whole day, and in other cases for 12 hours. So it requires a lot of application, and also all the contacts should be treated. All the contacts within the house, all of the intimate contacts should be treated, and they should be treated simultaneously.
What about chairs and beds? How
Yes,
do you deal
in
with
cases where there's a high mite count, you can treat the bedding by just washing the bedding in warm water.
Warm or really hot?
Well, you can use warm or hot water, or you can dry clean clothing, or you can press clothing. With chairs, you can just cover the chairs with a sheet or plastic. The mite usually lasts outside of the human body maybe about 3 days or 7 days at the most. So if you cover these things, or if you have clothing you can't wash and you put them in a bag, or let's say a stuffed toy, you put it in a plastic bag for 7 days, that would get rid of the mite as well.
We have to take a break, but when we come back, I want to know how they excrete themselves from the body, for want of a better expression. I want to know if there's something that you see after you put this whole thing on. Anyway, we'll take a short break and then we'll come back with Dr. Andrew Forde, our dermatologist.
Morning Barbados, good morning. Wake up, wake up, wake up. Morning to you.
All right, we're back with you, and we're talking with Dr. Andrew Forde. He is our dermatologist. This morning, our topic is scabies, and we've been explaining what this mite is and what it causes on the body, and certainly how it can be taken care of. But you just explained to us, Dr. Forde, how it is treated. So you talked about the burrowing. Do we see anything? How does it change when it's actually coming out of the body? How does that work, or does it just disintegrate in there? How does it
Well,
work?
it's important to know that without treatment, you don't eradicate the mite. The mite is there all the time. But with treatment, the mite dies. So what happens with the skin are that these very large bumps that you get on the skin go down. The itchiness and the eczema-type rash goes away. That's how you know it's gone. But left untreated, it's intractable. And I've seen people have this for 6 months, 9 months because it was undiagnosed. But the mite goes through a life cycle. They die. New ones are made because the female mite always lays eggs, and it can be a continuous process. One form that is uncommon is called crusted scabies or Norwegian scabies. And in that case, the changes actually look like psoriasis because lots of scales occur on the body, and the mite count can be in the hundreds under one of those scales. So that's extremely contagious. So for people in institutions, elderly people, they are very prone to it. Also, if you happen to be immunocompromised due to an infection or cancer, that can also cause you to have crusted scabies. people who are mentally challenged and are able to itch, or if you have a sensory condition that doesn't allow you to feel itching, then you can get this crusted form. But it's something that can be easily diagnosed and treated. But the doctor needs to have a suspicion. When someone comes with itching as a presenting complaint, it requires a very thorough examination of the skin.
But you know, can you mistake coach for that, for scabies?
Well, you could. Cow itch has more of a sticking, pricking, and it goes away. But the scabies comes at night, and also other individuals in the house get itching as well. So because children are there's usually one person who brings it into the household, and then other people get the itching sensation, and then their contacts who may not necessarily be in the house can get it. So it's a combination of the story and looking for those signs.
So how do people really come by this mite that causes scabies, and how common is it here?
Scabies is very common. I think every month you can see a few people with scabies. That's because it's underdiagnosed in our population. And as I said, you have to get it from hand-to-hand contact or intimate body contact. Since one of the important areas that the mite lives is between the fingers and on the wrists, that's why contact is very important. In children, you're always wrestling or they're always playing and you're always holding them. Your special partner, you're always close to them. So there are things that can cause you to
So this
get
mite
it.
is just out there. You don't need to be in any particular area or type of environment, or, you know, in a
It's there.
specific
Well, a person acts as a
You
carrier.
see what I mean?
Yeah, you don't get it
Okay.
from your environment or inanimate
I
objects
see.
very often, but an individual acts as a carrier and takes it to someone else.
You talked about hygiene impacting negatively. What about people who perspire a lot? You know, they tend to itch when it dries on.
Well, itching due to sweating can be due to prickly heat or so-called heat rash, or we mentioned urticaria on an earlier show as well, where the histamine is high in the body and you get swellings or bumps that last for less than 24 hours. So the important thing with the scabies is the nocturnal itching, or itching when you take your clothes off. That's something that the patient usually volunteers as information. And usually when individuals have itching, it's linked to, by other causes, it's linked to that.
How difficult it is as a doctor to diagnose it, because you're talking about some real personal information, and people aren't, receptive to sharing this.
Yeah, that's why the doctor spends a lot of time. You know, it can take 10 minutes or more actually getting a history from someone. The challenge for any dermatologist who is diagnosing a problem is a perception of the public that a dermatologist or a doctor can diagnose your condition by just looking at it. So we get a lot of patients who just want to show you something that's on their skin. But it's important to follow the process and to go through that historical questioning period to get all your information so that you've already narrowed down the diagnosis in your mind, and then you look at the skin with a view to eliminating them and coming up with one, or at least just one or two.
Go ahead. Okay, how long before the mites start to impact you? I mean, they penetrate the body and so on.
Yes,
How long?
well, between 2 to 6 weeks it takes you to get the symptoms, but the mite starts burrowing, as I said, every day it burrows a millimeter or two. And the thing is, if you have scabies and you get treated, you can always get scabies again. So this is why it's very important to treat everyone in the household, treat them all simultaneously, the same day, the same time, get rid of the bedding, do everything that you have to do, because if you get this ping pong reinfection, each time the body reaction is faster, so you start itching a lot quicker, start showing the signs of the papules and the pustules and the bumps and the burrows.
Okay. All right. Well, this is something
Seems
else.
to be making you kind of down. You're
Very concerned. So
Say the least.
no paranoia, please.
You know, people have a habit of wanting to squeeze things when they see them. What advice would you give people in terms of dealing with when they see these things?
Well, I don't think squeezing is ever a good thing, but it's in our culture, and I guess it's a form of affection to be checking and squeezing everything that's on someone you care about. But it's never good, especially when it's an infective process or an inflammatory process, especially around the face, between the eyes, areas like that. Sometimes, a lot of times, squeezing makes things worse. But certainly if you have itching for a long time and there's someone else in your family having itching, the important thing is that you should get checked for scabies. Another thing to know is that if it's caused by intimate contact, it means that you are at risk of getting other sexually transmitted diseases. Because if you can get scabies, there's a possibility that you can get something else. So scabies can be a warning flag for checking for other conditions.
Is that how it's categorized, though?
No, it's not. It's not categorized. It's just a mode of transmission. But you have to be aware that if
Makes
you
you
are that
vulnerable.
close to someone that you could get scabies from them, it's possible if you haven't done the right precautions that you can get other things. This is heading down the wrong road.
Thanks, Dr. Forde.
We're
And
adults.
where did the name come from? It's really
Well,
not a gorgeous name.
Yeah, it has to do with the name of the mite.
Okay.
Scoptes scabiei.
Okay.
I'm kind of curious though. Is there some other form of treatment other than immersing yourself from your neck down? I mean,
Well, you could put 6% sulfur precipitated in petroleum jelly
Steam
and
yourself.
just grease yourself down. And that's used for a lot of young children and infants. Also, sometimes for infants, we have to dilute the application as well, because infants have a very large surface area to body ratio, and they can absorb things very quickly. And there are some treatments that are not used very much, because if you're very muscular, low body fat, they absorb very quickly, they can get into the bloodstream. So one of the treatments, which is called lindane, isn't used a lot in very low body fat muscular people. But if you don't treat it, Doug, it's not going to go away. So.
okay. I'm wondering, any relationship between scabies and lice?
Well,
the crab lice?
they are infestations.
Okay.
And it's just the the causative organism is different, and in mites there is itching as well, but it's related to areas, either the body, the genitals, the scalp, and you also look at the hair in some of the areas, because they have these things called nits, little houses that they live in, and you look for active lice. But some of the same applications are used to treat lice.
Okay, all right. You say that the scabies can stay in the body for up to 9 months.
Undiagnosed.
Undiagnosed.
If it isn't treated, you just have scabies and you itch until it's treated. So some people can move from doctor to doctor being treated for eczema. The problem is that if you use a steroid, the steroid masks the inflammatory signs that we saw, and the itching persists. So the person feels better for a little bit, and then the itching returns. But the areas that itch are the giveaway sign, as I said, between the fingers, the wrists, the nipples, the navel, the genitals, the buttocks. So.
If anything itches, go to the doctor.
Yes, definitely.
See a dermatologist.
Just don't scratch it.
It reminds me too of we don't see a lot of them anymore, but chinks, bed bugs.
Okay, that one made me laugh. Yeah, we don't see that very often. But I think we've developed a lot more. And
that used to happen more when
see.
people had the grass beds and that kind of thing.
Yes, bed bugs aren't very common. I mean,
Right.
you might see someone with bed bugs once a year or twice a year, but a lot of them come from other countries, or may have spent some time in the U.S. in a hotel or something.
But that's what I wanted to raise, because I know there was a huge scare in Manhattan about 2 years ago.
Really?
At a lot of the major hotels where there were significant infestations of chinks.
chinks?
Yeah.
Wow.
Well, again, there are some similarities in the presentation, in that there's itching, but these bumps, which are called urticated papules, which is a red swelling with a little dot in the middle from the bite. These things usually come at the edges of your bed clothing. So if you wear something, if you wear like shorts and a shirt or something, then you get the lesions in the neck. If you sleep naked, then you can get them anywhere.
Okay. All right. Thank you, Dr.
explains
Forde.
that.
You have shed a
Scabies,
lot of light on a lot of itchy
Yeah.
situations, and I really hope that this information has been helpful to you,
Yeah,
and
we-
you're a little more
But I have to
sensitized
say,
and aware.
we're only scratching at the surface.
Okay, that's so corny. Anyway, we will be right back. There's more to share with you on Morning Barbados. And yes, the brands of summer, Cave Shepherd and Colombian Emeralds, making sure that they stay with us this week. So keep paying attention. It's all about the Lauren G and Milano brands today.
Okay.
Yes, we'll be right back with more on Morning Barbados.